Good morning, class. Today we are going to talk about insurance maximization, which is an important concept for the CCA exam and for real coding practice. Insurance maximization means making sure a healthcare provider receives the full and correct payment from an insurance company. This is done by coding all documented conditions and procedures accurately and completely, while following all official guidelines. It is important to understand that insurance maximization is legal and ethical. It does not mean increasing payment by using incorrect codes. Instead, it means making sure nothing is missed and everything is coded correctly. There are 4 key parts to insurance maximization. First is accurate coding. Coders must choose the most specific IC 10 cm, CPT, and HCPCS codes based on the provider's documentation. For example, if a patient has type 2 diabetes with neuropathy, we should not code diabetes alone. We should use the combination code that includes the complication. Second is complete documentation. Coders can only code what is documented. If the provider documents more detail, the coder can report more specific codes, which can affect reimbursement. Third is proper sequencing. The order of codes matters. The principal diagnosis must be the condition chiefly responsible for the visit or admission. Incorrect sequencing can lead to lower payment or claim denial. Fourth is the correct use of modifiers. Modifiers such as 25 and 59 help explain that procedures or services are separate and should be paid accordingly. Now let us be clear about what insurance maximization is not. It is not upcoding. Upcoding means assigning a higher level code than what is documented, and that is considered fraud. It is also not guessing or adding conditions that are not in the record. Let us look at a quick example. A patient has diabetes with chronic kidney disease stage 3. To maximize reimbursement correctly, the coder should report the diabetes with complication code and also the CKD stage code. This ensures complete and accurate coding. In summary, insurance maximization means coding correctly, completely, and in the right order to ensure full and proper reimbursement, while staying compliant with all coding rules. What does insurance maximization mean in medical coding? Answer: Insurance maximization means ensuring full and correct reimbursement by coding all documented conditions and procedures accurately. Why is accurate coding important for insurance maximization? Answer: Accurate coding ensures the provider receives proper payment and avoids claim denials or underpayment. What must be present before a coder can report a diagnosis or procedure? Answer: Proper provider documentation must be present. How does sequencing affect reimbursement? Answer: Correct sequencing ensures the principal diagnosis is accurate, which directly impacts payment. What is one example of a combination code? Answer: Type 2 diabetes with neuropathy coded as E11.40. Why are modifiers important in insurance maximization? Answer: Modifiers clarify services and ensure separate procedures are paid correctly. What is the difference between insurance maximization and upcoding? Answer: Insurance maximization is accurate coding, while upcoding is assigning higher codes than documented, which is fraud. What can happen if codes are not specific enough? Answer: The provider may receive lower reimbursement or the claim may be denied. What role does documentation play in reimbursement? Answer: Documentation supports all codes and determines what can be billed. Give one example of proper insurance maximization. Answer: Coding diabetes with chronic kidney disease using a combination code plus the CKD stage.